Some people in our hospitals are vaccinated and many are immunocompromised. Now, they have to rely on others to do their part. 10 Tampa Bay's Angelina Salcedo spoke to the wife of a man who got a shot only to find out he still wasn't protected.
I will never forget the day he was diagnosed with cancer. I used to say like that was the worst day of my life, but him being intubated was probably the worst day of my life.
The last 15 months have been a whirlwind. Tallie Tidwell's husband, Ryan, was diagnosed with cancer at the height of the pandemic.
He has specifically acute lymphoblastic leukemia.
Months later, he tested positive for COVID-19.
He was definitely shocked. He was almost in disbelief as well with everything going on.
COVID landed the Cape Coral couple back at Moffitt Cancer Center for treatment. After an antibody infusion, he got to go home, but is back after his symptoms started again.
We met with the infectious disease doctor and they said, you did not develop any antibodies.
According to a study from the Leukemia and Lymphoma Society, Ryan is part of the 25% of blood cancer patients that do not produce antibodies despite being vaccinated for COVID-19.
How can the Delta variant affect someone who is immunocompromised?
They could be 2 to 4 times more likely to catch the infection than you are because their immune response is not as vigorous.
Moffitt Cancer Center's Dr. John Green says COVID-19 vaccines aren't foolproof but can save lives, especially those who have weaker immune systems.
Healthy people can help those immunocompromised relatives and friends by getting vaccinated and putting a wall of protection around them.
I just think that a lot of people don't really understand the science with it. Science saved Ryan's life the first time, and it's going to save his life again.
Ryan is getting better with time. Dr. Green says booster shots will be the next best thing to help those that are immunocompromised fight COVID-19. We could see those in the coming weeks.